So your first zygoma may not be your first zygoma. You did many times in your brain and
yes,
on
yes,
the
yes.
skull.
True.
And what about your quad zygoma? Because when I went for a course in Pico's Institute, what Pico's doctor told is there is a lot of difference between a single zygoma and a quad zygoma. They are not at all similar. The quad zygoma is very more complicated than a single zygoma. He was telling like that. So what is your opinion about that?
No, it is not different at all. It is doing both zygomatic implants are same. Quad zygoma is also same. The different ball game is like the only thing what you should be really concerned is posterior area where we are placing a single zygomatic implant. It is already highly resolved, so we have a direct access to the zygoma.
Yes.
Whereas anterior, from where you want to do a quad zygoma, from the front implant which goes into the front implant, usually some or amount of bone is there.
Okay.
5 mm, 6 mm, 7 mm bone is there. So it is your judgment, it is a level of judgment, how much bone should be removed, only then it will go properly, otherwise it will go into the infratemporal fossa. If you don't remove the bone properly, it go into the infratemporal fossa. And if you remove too much also, if you go too deep also, it will go into infratemporal fossa. If you don't remove any bone, it will cut the lateral surface of the zygoma, and patient may never ever get a zygomatic implant. So that judgment is very, very important. The technique is same. What I want to say is the technique is same, but doing single zygoma is very easy in the sense because going from a highly resolved area, it is easier.
Sure.
But here, the same technique we are following, but only thing is we have to do certain things before starting placing a zygomatic implant. Otherwise, if you don't just prepare it, you directly start doing it, then just like your posterior implant, then this will definitely go wrong. And one more, the biggest problem is accommodating two zygomatic implants in a single zygoma bone. Okay, so Indians, majority of the Indians, they don't have this big face, big skull. They have a very short face, short bones. So what I personally do in my patients is like I just keep my finger like this, one on the infraorbital rim, one at the bottom of the zygoma, and keep two of my fingers. I don't see the CBCT. Even today, just today, before coming here, I operated a quad zygoma in Chennai, I operated a quad zygoma. I didn't see the CBCT. I just went and then I just checked like this. I hold like this, and I kept my two fingers like this. Two fingers. So two fingers were like I'll just do it like this. That means without touching this two fingers, I am able to move two of my fingers. And my zygomatic implants is not that this thick also. So that means I can easily accommodate. That's a rule what I follow personally. Simple rule, clinical test. So if any patient is having very short zygoma, then I would love to go for the transnasal implant. That I do.
Your first quad zygoma, any preparations did you?
One thing, whoever is watching this podcast, most of them dentists and a lot of patients. Of course, patients, they just only get information, but if any dentist is watching, I would strongly recommend not to do a quad zygoma just because you started doing one or two zygomas. First, they have to do at least 30, 35, 40, 50. There is not particular number until, there is no particular number, but until you get so much confidence that you can easily execute this, you should not do a quad zygoma. You start doing only single zygomas. But a point comes that you are bored of doing single zygomas. You can do anything without doing CPBCCI, everything. You are so much confident. Then you start doing quad zygomas. But at the same time, single zygomas is easier because you are operating far away from the eye. You should always remember, like since you are going closer to the eye, you can't damage eye, and then you cannot undo it. You cannot undo it. So you should be very, very careful in surgical planning. Surgical planning is very important in a quad zygoma, whereas not much surgical planning is required for a single zygoma.
Okay. One of our friend, he went for a zygoma course in Turkey. So in the course, during this course, live surgery, they entered
orbit. Oh my God.
So that kind of issues can be prevented by following what?
Yes. And there are a lot of other safety parameters what I do, like marking and everything. Thereby I ensure that it does not go into the eye at all. We are safely far away, at least by 5 millimeters, 4 to 5 millimeters away from the eye. And the second implant also we are able to easily adjust into the zygomatic bone.
When I attended your training program course, after the surgery, when I saw the X-ray, I got surprised. Because both sides are looking the same.
Same.
You can bend the X-ray, they will
like mirror images.
Yeah, yes. I also told you got some some software inside your brain, which so what
No, after you told me the same thing, then I referring your name that see such a Murugavel, such a great person has given me this credit, that sir, there is a muscle memory in your now. Without the brain connection, your hands are doing on their own. So that was like a big moment for me, because appreciation coming from such a great person is means a lot to me. So even I started telling people that, Murugavel, such a great person, is telling me that, sir, you got a muscle memory. So it is all about a planning. I would say, like, it is all about a planning. Some they do draw lines and everything, but I just know where to do, how to do. So that is how I plan in my brain and do it. I'll open the flap and then do it. So that is how I am able to easily do it.
Okay. Easily do because it. What I observe is when we do from the right side, we do more angulation mistakes on the left side. But it is not happening in yours aspect. So, you are doing, both side your approach is same. Both side target as same. Because for me, the left side, many times some angulation issues will happen. So
it is more of a common sense rather than, no textbook will teach you this. Yes. It is like, you are doing something today, you just doing something, somewhere you feel not comfortable, or you're not doing, somewhere something is going wrong, or I'm not comfortable doing this. Then what is a better way of doing it? Simple. So it's like there are a lot of common sense things which no textbook, no friends, no even mother, father also don't tell you each and everything, do like this, do like that, do like this. Nobody tells you. But there are always every work can be done in a different other way, in an easier way. Only thing is we have to constantly pursue and then focused, as you said in the beginning, if you are focused, then you can do it. So now if I'm doing it like this, somewhere, many of them doctors ask them, sir, left side is easy, sir, right side it's somehow difficult. Then why are you doing the same way? Try to find out the reason, what is the problem here, because you cannot do it like this. See, it's just like pushing is easy, pulling is difficult, something they say, no? So then figure out how you can do it in a different way and the easiest way. It's all about matter of convenience, that's all. And
you also told about going to Israel to attend
yes.
That was quite
yes.
Can you share something?
No, actually, like in India, like, many people don't want to share here. I'm not talking about now. I'm talking about 2015 to 2017. Okay. So when I started using some implant systems, the quality was very poor. So I said, like, we should learn from people who are doing great in this field. So I went to Israel, Tel Aviv, Dr. Igal Balan. So there, after I have seen his work, then only I came across this Noris implants. So I started doing this Noris implant because the internal hex, everything is strong. And when I have gone there, I have seen his clinic, infrastructure, how he's built up his staff and all equipment, everything. So how he is marketing himself. So not only the subject, we have learned so many things from him. So it was a good experience. Especially when you go outside of India, you get to learn a lot of new things. But the present generation, they don't want to spend money and then learn. They just want to learn everything at home, on the internet, everything by free only. So I would recommend, everybody go out and learn, pay and learn, rather than learning everything free. So free is always there by your side, but sometimes you go outside, select a good mentor, select a very good mentor who is doing something exceptional in whatever you want to do. In the same field, somebody is doing very great, then you just mail him, message him, call him, say, doctor, whatever is your fees, I am willing to pay and learn from you. Most of them will agree and then invite you to their practice, and they'll let you learn also. Because most of them want to share. It's not that they don't want to share, but most of the premium courses are not free. Premium courses are we have to pay money and then learn. That's all. So that's how I learned a lot of things in different places. I personally have attended 8 courses.
Okay.
I personally have attended 4 international, 4 domestic.
Okay.
4 domestic, 4 international, but we have learned a lot in international.
Okay.
Here, I would say the best mentor in my life is Srikant Mallan. Srikant Mallan from Alleppey, Kerala. Is a very down-to-earth person. I don't think you can find his name on Google, Instagram and all. But
he is into TMJ also?
I don't know, but he's a prosthodontist.
Okay.
I don't think
because
he's a...
I met him in US for some course.
Okay.
He also came.
Will have full
Yes,
hair,
full, yes.
full hair, full hair,
okay.
lot of hair. And he don't talk much actually. He don't talk much. He's not seen anywhere. Nobody talks about him also.
Okay.
He's not that social media savvy guy. You don't get to hear him, but whoever has met him will talk very good about him.
Okay.
He is just like you only.
Okay.
Very down to earth, very humble, but big man.
Okay.
He has done lots of implants, but nobody knows that he does so many implants.
Okay.
So that is a greatness with him.
And you told, Zygoma, Zaga types. You observed the differences in the whether it is flat or concave. When I attended a Carlos Aparicio program, I asked him, so what moment you found this classification, this Zaga 1, Zaga 2, Zaga 3? So he was telling when he was going through all his X-rays and thing, suddenly it got stuck him that there is a difference in anatomy for everybody. Everybody's anatomy is not different in that aspect, whether it is concave or flat or what. So without knowing this, he was struggling for 10 years. He told, I was, I could have found it in the earlier itself, but suddenly it got strike him and he divided this classification.
Yes.
I think you also observed this.
Yeah, same thing I observed in YouTube, but we took, fortunately we did not struggle for 10 years. We could figure out in 10 days time.
Okay.
But definitely, I have a huge respect for Al Capriccio. But next generation will do faster than me. So that is not to demean anyone, but things are changing. A lot of people are willing to share their knowledge. A lot of people are willing to learn also. And one more important point I would like to tell in this podcast also. Many senior most doctors are calling now. Senior most doctors are calling, and they're especially those who are doing zygomatic implants. They are asking me, don't conduct courses.
Okay.
Don't share your knowledge with the younger crowd. Why you want to develop own competition? Now every city already you have trained so many people. Most of your students have started doing zygomatic implants, and why you want to be a privileged doctor where you are the only one and few others. Let only few be the one who are doing zygomatic implants. Why you are training every day, every week so many doctors means I have only one answer for any of them. See, not only zygomatic implants, anything. Suppose you have the willingness to learn. Suppose if I deny you, you will go somewhere else and learn. Simple. So at least if I teach you whatever I know, honestly, whatever I know, at least you will have a gratitude towards me that, I learned from Dr. K.A.Reddy. Otherwise, what you will feel, you will attend my course, then I don't teach anything, then you go somewhere else because you are destined to learn. Nobody can stop you. If somebody is destined to learn, nobody can stop him because in that way, the world is big enough. The world is big enough. Of course, many people say world is small enough, but world is big enough to learn. World, some or other place, somebody is willing to definitely want to share and teach you by holding your hand. Okay. Only thing is, it takes some time to find that particular person. So if not some or other way, you will find it because now because of the social media, it's easy now. So I want to be the person who is willing to share the knowledge and have that gratitude towards me that, because of Dr. K.A.Reddy, you're doing. And there is no shortage of patients, first of all. There is no competition at all. There is no shortage of patients. We have n number of patients.
130 crore people in India.
130 crore people in India. Lot of Zygoma patients are still there to operate, still to get operated, and many more will add now. So there is no shortage of patients. So I don't want to be a bad guy, especially like.
I remember one English proverb. the candle doesn't lose anything, no, when it is lighting other candles.
That's
I
it.
think you are
Simple.
also following the same.
Simple.
At what moment the idea struck in your mind to start Zygoma courses?
Zygoma courses, like, so initially we, frankly speaking, we wanted to, when we learn, we wanted to also make some, what exactly was a turning point also, I'll tell you, not exactly the zygomatic courses.
Okay.
In general, talking about in general courses, what we are conducting across India and especially Hyderabad, and I also go as a consultant for different clinics for zygomatic surgeries. The biggest turning point was in my clinic, we had some patients, poor patients, where they cannot afford my fees. So we used to reject them that, since you cannot afford my fees, so you go elsewhere, or you find some other institutions, something. Then they said, so no institute is ready to do these zygomatic implant surgeries. Then I felt bad because just because of financial reasons, we are able to turn away these patients. So how we can incorporate them in our practice, help them. At the same time, we can also help the other doctors.
Okay, yeah,
So that's when we devised a plan where we'll take all these poor patients, whatever they can pay, let them pay. Then doctors who want to participate in the courses, they'll also get to learn by seeing live surgeries.
Yeah.
So it is like a win-win situation for
Benefit for
everyone.
all the
It is a win-win situation for all, where I get my money and I'm sharing knowledge, and at the same time my name is also becoming popular. Patient is getting teeth in 7 days.
Yes.
And these people also, doctors learning, and they do good for their own patients. So in general, like overall mankind is benefited.
Yes.
So this one thing.